everyone. My name is Lisa Romero, and I'd like to thank our panelists and our guests online for joining us live for this inaugural event in our new BIO5 Ignite Science series. The BIO5 Institute at the University of Arizona connects and mobilizes top researchers to find creative solutions to humanity's most pressing health and environmental challenges. Since 2001, we've been harnessing the power of diversity and inclusivity to ignite scientific discovery and innovation and to prepare students for leading, living, and working in a diverse world. At BIO5, we are not bound by any preconceived definition of who someone is or what can be accomplished. BIO5 Ignite Science will be an ongoing event series that showcases how the value and diversity of thought, ideals, culture, approach, personal experience, and professional expertise is embedded in the DNA of BIO5 and how we foster an inclusive, open-minded, and supportive environment. As we begin our conversation this evening, I just wanted to share a few tactical details with our viewers. Our panelist discussion will last for about an hour with live Q&A to immediately follow that. So please feel free to type in your questions in the chat as we go, and we'll get to as many as possible during the final 30 minutes of the event. So now I have the pleasure of talking this evening with some of my favorites. They're all members of the BIO5 Institute, and each brings a unique perspective and background to the table. They are accomplished scientists, incredible mentors, and honestly just inspiring people. But don't just take my word for it, let's introduce them now. Dr. Mai Khanna is an associate professor of pharmacology and an assistant professor of neuroscience. Mai is energetic, innovation-minded, and mentorship means as much to her as success. Dr. Julie Ledford is an associate professor of cellular and molecular medicine, immunobiology, medicine, clinical translational sciences, and applied biosciences. Julie is driven to find solutions to problems, is highly collaborative, and is also very funny. Also, I think I might have seen it is your daughter Elle's birthday today. Is that right? So happy birthday to Elle if she's watching. Dr. Michael Johnson is an assistant professor of immunobiology and applied biosciences. Michael has a brain that never rests. His favorite metal is copper, and he's a Twitter icon. Dr. Ben Renquist is an associate professor of animal and comparative biomedical sciences, nutritional sciences, and psychological sciences. He is working to eliminate a health scourge that affects nearly 2/3 of Americans, obesity and obesity-related disease. He's a caring educator and a truth teller. So hello there, welcome. Thank you all for joining me today for this discussion. So I think what we're going to do is start off individually, and Julie, since you're wearing your BIO5 pin, I'm going to pick on you first. Sure. And I'm just going to have each of you tell our viewers a little bit about yourself. Give us an elevator pitch of what you work on. What does your work mean to Arizona, to the world?
Goodness.
Yeah.
Okay, well, thanks.
No pressure.
I'm excited to be here today, so thank you for the invitation. As you said, I'm Julie Ledford. I'm originally from Georgia, so I'm really excited right now that the Georgia Bulldogs are doing so well in football and the Atlanta Braves just won the World Series. So I'm the happiest Georgia transplant in Arizona right now. But my lab, in all seriousness, we focus on lung diseases, and specifically asthma, COPD, and a little cystic fibrosis, and how do respiratory infections, such as common ones as mycoplasma pneumonia, rhinovirus, which are the common cold, and walking pneumonia, how do they really impact the health and the lungs of those people that are already inflicted with a chronic lung disease? And so ultimately what we want to do is find out how proteins that are in your lung can control these responses, and then can we harness the activity of those proteins that are in your lung to make new therapeutics to help people have better lung health. So that's it in a nutshell.
Thank you, Julie. Dr. Johnson?
All right. So when bacteria enter into your body, they can't take luggage. They can't take, gummy bears or snacks with them. They have to acquire all of those nutrients from within you to actually function and multiply. And some of those nutrients that they need are actually metals. Some metals for them are good, and some metals for them are bad. the metal that I actually study is copper, and whereas our bodies use copper in a lot of different reactions, and it's also nice that we're in the copper state of Arizona, bacteria actually don't like copper, at least the bacteria that are pathogens or bad for us. So we have three major questions that we try to address in my laboratory. One, how is copper actually toxic? If we've been using it since antiquity for copper pots to preserve stews, if we've been using it to spray on vineyards to preserve the grapes so that we can have our wine, and if you're not a wine fan, you can also spray it on potatoes. So probably got you with either the French fries or the wine, maybe both. So if we are using copper to protect all these things, we should probably know how it works. So that's what we study. The second question is, how does the pathogen actually fight back against this copper threat? And the third question is, can we actually weaponize this to make some sort of copper-based therapeutic as an antimicrobial? So I'm happy to be here, and I'll turn it back over to you.
Thank you, Michael. Dr. Khanna?
So my name is Mai Khanna. I was actually born in West Africa and then came to Michigan as a teenager. From Michigan, went to Indiana, from Michigan to UCLA for a postdoc, from UCLA to Toronto, from Toronto to Indiana, and finally I made it to Arizona. So it's worth mentioning that I am a transplant of many different places from all over the world. And my lab is actually very excited about looking at, we're really interested in neurodegenerative diseases and trying to find therapeutics for neurodegenerative diseases such as ALS and Alzheimer's, and PCH1B and Batten disease. It turns out all of these are neurodegenerative diseases that do have some commonalities. And we look at them in terms of, just like Julie was mentioning, it's just like Michael was mentioning, at the protein level. So we're at a very basic level, which I'll put in a sort of prop for basic science. It turns out all of you that are here are actually paying for much of the sciences that we can do that ultimately translates into therapeutics. It's really important to understand and sort of appreciate what we all do that ultimately leads to cures. And so my group looks at just very unusual ways of targeting these very basic proteins to find really unique pathways to target for these diseases. So we have a lot of fun doing it. There are a lot of different ways of looking at these therapeutic modalities, and we love what we do. So thank you.
Thank you. Dr. Renquist?
So I grew up on a farm in eastern Colorado, showed cattle, showed sheep, always was interested in animals and how they grew and why they grew and how they became big enough and ready for us to consume them, and transferred that desire to understand growth over to humans, where we're probably growing too much now, becoming slightly obese, and wanted to understand how that obesity was causing all the complications that we see, including diabetes, hypertension, asthma, a number of complications that are associated with obesity. And so my lab really focuses on how the liver is involved in causing these diseases that are throughout the rest of the body. And so how does one organ communicate with the rest of the organs to say, I've got way too much fat in me, please change the way you're metabolizing or handling nutrients to accommodate that.
Great. Thank you all. As I said, incredible scientists, and we're going to get to know them a little bit better throughout the rest of the interaction. I think with the rest of it, I really want this just to be conversational, so I'm going to kind of throw out some ideas, and you guys can talk, because this is your area of expertise. So, tonight's episode is about sort of collaboration, inclusion, diversity, how we use that and build that from the bottom up, and we use it to build and empower a mindset that drives your work. So I'd love to just have you talk. Anybody can pipe in how that looks in terms of approaches that fuel your scientific discovery and innovation in unique ways. What that really means when it's embedded in the very nature of the work you're doing. Anybody want to kick that off? All right, Michael.
He's smiling.
He's sitting next to me.
There's so much that goes into research. There's so much, and it's interesting. Every laboratory that I've been in, every experience that I've been in, that I've had, it kind of leads to this point where it teaches you either what you want to do in the laboratory or what you don't want to do in the laboratory, because there are negative experiences that we do actually encounter. But when you're trying to kind of like, I guess, move toward a more ask a specific scientific question. You try and think of all the things that go into that particular scientific questions. How many different ways can you approach it? You can have one method and apply that method to many things, or you can have a lot of methods that kind of go into one question, and it gets really complicated really fast. But it's along the way you just try and pick up as many tools of the trade to do that as you possibly can, and then you get to this point as where a professor's here, and you get this all of a sudden you get this really nice autonomy to be able to ask a question that you just is burning inside of you, and it's really a wonderful experience.
So and to kind of just jump onto that, the experience of sort of answering these questions, right? Often we have a very specific question, but having the diversity of mind in our trainees, I think it's so important. It comes back to right? Because we are very focused on, this is what I really want to answer, and this is how I want to answer it. And then you get trainees that come in and they say, well, I don't understand. Why are you asking it this way? What about this? And it's like, wait, I hadn't actually thought about that. And the more diverse you have in that population of thought, the more exciting the questions turn and they change. And I think that's, I've been thinking about it since you've invited me on this. What are, of course, we know what are the normal, what everybody says diversity is important for, but we're experiencing it on a daily basis. And when Michael was mentioning about sort of successes and failures, in fact, the one thing that I tell anybody who comes into my lab, the vast majority of the time you're going to fail, right? Are you ready for a 98% failure? But we're not preparing our students for that, right? They come in and they believe an A is a success story, and that's wrong. When you go into a lab, be ready to get E's and F's all the time, and that is the way you actually start to succeed, is when you've failed a lot. And I really do believe actually students who've struggled understand that a lot better than students who've really succeeded, because they sort of see the significance of failure and how it has built them. So to me, that's such an important point to keep mentioning over and over. Don't be afraid. I see this all the time. Do not be afraid to fail.
Learn how to fail early.
And be okay with it.
Be
right?
successful at failing.
Exactly. And that's, the more you fail, the more successful you will ultimately be. But that takes a long road and a very difficult road. So.
Well, I think the other thing we do, though, is we create this idea with that A being the right thing, but we also create this idea that you've got to be linear in, you've gone from high school to college, now you've got this plan for going to graduate school or medical school or whatever, and you need to focus on continuing that linear path. And I've found that, obviously I have some students from majors that I teach in, animal science and veterinary science, but I've had chemistry majors, I've had computer science majors. If I can bring in those people who have completely unique skill sets, where I understand virtually nothing of what they know, those are the people who can make my science the strongest, and the students who can help me the most. So that's what I like. And that's actually how Mai and I got started. I had a chemistry student, and I couldn't advise a chemistry student very well, so I brought her in.
Actually, we met before that.
Yeah, we met before that, but he was the driving factor for us really going.
That's right. I would just say that I wanted to bring up a different diversity issue, and that's the diversity of the faculty and clinicians that we have here, which is so deep. And I like to, if I have a new piece of data I'm really excited about, but I don't know what it means exactly, I like to send it to 5 different faculty members in totally different fields and say, what do you guys think this means? And I get 5 different answers, but it really sparks some intelligent conversation, and just really listening to everybody's opinion and thoughts is part of what makes it exciting, especially here in BIO5.
Yeah, absolutely. And I think that's, one thing I love about BIO5 is you all are from different, everything we just talked about, different backgrounds, different expertise, different places. And I love to say, we have events like this and others where people start talking that have never met, and they end up doing projects together, and that actually happens on a regular basis. And I think for me, that's one of the things I love about our BIO5 scientists the most, is that they really do take that to heart. So you talked about working together from different backgrounds. So I'm gonna pivot right to you guys on that one. So talk a little bit about unlikely teammates that you are, and how you are working now together on a specific project, or maybe projects at this point, to sort of look at the field of respiratory disease biology and transform it.
Sure.
How did you get there? How did you meet? Tell us the meetup story.
Well, we met. Where did we meet? It was at the faculty. What was it?
It was the Faculty Fellows Program. So it was actually a DEI initiative from the College of Medicine, where they had new faculty come in, and they paired them with a mentor, and they kind of said, okay, here's what you need to, here's basically your new faculty boot camp, of things that you really need to know. And across the table there was this Tar Heel. So I shouldn't speak that poorly upon the Tar Heels, because I actually got my PhD from North Carolina. But my alma mater is Duke. So I went to Duke for undergraduate, where I majored in music. So there's that.
We'll talk about that.
Yeah, there's that weird background for you. And I was just like, okay, she was a Carolina fan, I was a Duke fan.
Probably not gonna work out.
And yeah, it was usually if you hear that, it's destined for failure. But we really started talking when I think we went to a restaurant. It was like the end of the program. They were getting us all together, and we both bought our daughters. So happy birthday, Elle. She bought Elle, and I bought my youngest, Camille. And lo and behold, they were in the same school and in the same grade. And they start bonding over, I don't know if you remember this, they start bonding over like watching the show Larva.
So Larva's interesting.
It's an interesting show.
Yeah.
It's exactly like it sounds, but as a cartoon. I don't know if I recommend it. But hey, it worked for us, right? And they were like, well, maybe we should get like coffee or something and talk about our individual projects. And
so then back on campus, I called him up a few weeks later, and I said, I have this project that I'm having difficulty moving to the next step with. Can we talk about it? And he said, sure. So I showed him the protein sequence. So I think it's kind of interesting to talk about our backgrounds, because Michael is talking from the background of like the microbes and how they attack like the host, right? And I'm the host, and I'm like, no, combat the microbes. So we had this like different interface, right? So he knew a lot about the biochemistry of the proteins that I just didn't understand. So when he looked at the protein that I was interested in, he immediately knew there was a binding site there that was really important for asthma. Cool. And so long story short, we got a grant together, which was great, to fund the work, and we got a really nice paper to help explain how we can help protect against lung disease. So that's exciting.
Very exciting.
Yeah,
I can't wait to see as an asthma sufferer myself, and with my daughter suffering from that, again, very exciting projects that come together when you're looking at things from different angles. And so teamwork here as well. Basic science, pharmacologist, animal and comparative behavior.
Yeah.
Let's hear about your meetup.
Well, one, I don't think either one of us can do what the other person does, or even mostly understand what the other person does. So I guess you don't have to understand. I don't need to understand what Mai does. I need to understand that she's going to do it well. And that's it.
Fingers crossed.
You're right. Yeah. So we just met at a scientific conference, Arizona Biomedical Research Commission conference, and it was actually a colleague that introduced us. And 2 years later, we finally started collaborating because of that student I had mentioned earlier. So ours isn't nearly as exciting as
Wait, it is. He's forgotten a little bit. I'm just going to add a little bit of excitement to this. So it was at the ABRC meeting, and you came up to me, and you said, hey, would you mind coming up to my poster? Because I noticed that you were doing this like docking stuff. Would you check it out? And so we both walked to your poster, and you said, I had met somebody else, and they suggested this, and I'm like, no. You need to do it this way. And you're like, oh, yeah, that's really cool. we should totally collaborate. And I was like, yeah, okay, sounds good. Yeah, that sounds really. And so it was the ABRC meeting. I think it's one of the most interesting meeting I have ever been to. I think I'm the only one who asks questions at this meeting. It's literally from the earth sciences all the way to immunobiology. You have never seen such different topics in one meeting. It's amazing. Like, I don't think I've ever seen such a diversity of topics in one meeting. And so you sit there and you hear about the earth and about immunology and cancer and neurobiology, and because they have funded all of this. Again, to those of you who are watching, it's your tax money that allowed us, that several of us had ABRC grants that really helped out, which was really tremendous. So please congratulate yourselves to having some really, to funding really awesome science. And that's kind of, there was a poster session after the talk, so everybody's presenting posters, and he had seen one of our poster where we had seen some in silico work and in silico docking, so developing a small molecule on a computer computationally. And that's when Ben kind of was like, hey, this is really neat. And so the meeting was a little cooler than you remember.
but let me point out, she was really cool, and it took me 2 years to get her warmed up.
So through a student, so this gives you an idea, you students out there, how important you are. Exactly. Well, it was through a student that finally Ben said, hey, you have this really cool class, can he attend the class? And I said, absolutely, to him, come in. He came in and did some docking. And this is another thing I always tell students. In my class, I'm able to get Schrodinger to give us software that's worth probably $200,000 for free. So you have a lot of power in your hands as a student to really drive a lot of innovation in labs. And our students work together. My student went off to Harvard for the PhD in chemical biology. His graduate student went to Stanford. And so they had a beautiful collaboration, and we have papers and now grants and several things that are in the pipeline because of that.
Well, I mean, that's a great segue. So, I mean, talking about the incredible science that you're focused on is one thing, but we are part of an academic institution, so equally important to us, to all of you, is exactly what you've been describing, is the students, and what you're providing as tools for them to move through their education into whatever their paths lead to. So each of you works with students in incredibly unique ways, and I want to probably ask each a bit about their own personal things. But Mai, let's start with you, because when I heard about this class that you're going to tell us about, I was like, that is probably the coolest thing ever. Just the concept of it, that you saw the need for it. We have an institution where you were able to develop and implement it. And I'll let you talk about the class and sort of what the results of that have been, what your students and now graduates are working on. Tell us about the Designing Drugs Chemistry to Cure class.
Yeah. So it's a super fun class, and I'm so thankful for the University of Arizona for actually allowing me to do this. Like, I don't think I would have been able to do this in many other institutions. And it was really the chair, the Tech Launch Arizona, BIO5, all of these environments that really the environment was right for this. So I pitched it to my chair early on, which was the idea that could we set up a class that basically would go through designing a drug in the class, but then at the end of the class they would actually start a company. And as incredible as that sounds, that is exactly what we ended up doing. So the students go through this class, and Ben's student actually went through it. They go through designing drugs in the class. They had met several people who told them about the whole FDA process. How did they go through it? The timing was incredible because NIH had released their MPD. Again, thank you for all of those of you who pay for your taxes and allow us for NIH money. NIH had released this trove of treasure of targets that were for Alzheimer's disease. And the students literally were targeting proteins that no one else had even seen. Because I happened to be part of MPD, and so they released these to the classroom before pharma, before anyone else in the world had them. So they had these proteins that no one else had, targeted them. The first company, ClearSat, is driven almost all entirely with women. It's a women-driven company, beautiful, wonderful driven scientists. I'm really excited for what they've done. And the amount of support, so I was able to raise them $30,000 through Tech Launch, through Center of Innovation in Brain Science, College of Medicine, College of Pharmacy. Every one of these were so excited about the outcome that they actually funded this particular company. So this company has money, they're actually raising it, they're developing an antibody, we already have the first round, and we'll be testing them in animals. This is all out of the classroom.
Wow.
So it is just super exciting to give. And the second generation is also starting, they now have a target, and I've always told them, the beauty of it is that they all now believe in entrepreneurship. It's not a word, it's not something someone's guided them, they are jumping into it and doing it. And one of the students, Jessa Strong, who's the CEO of the first company of ClearSat, actually stepped out, was going to pharmacy, decided to step out, is now the CEO, is getting her degree in business, and is going to continue running this company. So truly incredible outcome.
That's amazing.
I say right to the students, you have a lot of power. You are so implemented into this linear path, you forget that there are actually so many other paths that can be taken and be successful. So it's been a wonderful class to implement. It's just been such an honor to be able to set it up, and so much support for it. So it's super exciting to be part of that.
That's amazing. And I think you're right. Scientists used to be trained as scientists, and they didn't, they weren't trained as business people, as entrepreneurs, and more and more, I know you all are faced with having to do a little bit of all, or a lot of all of that, right? So I think that that's, an incredible opportunity to learn the business of science and, how that all works. It's complex on both sides. So thank you for all you've done there.
When you teach them how to pitch,
Yeah.
you teach them a lot.
The marketing.
Beyond the chemistry
Yes,
side.
The marketing.
Exactly.
I wish I had taken this class.
Yeah.
So I sit in on like her pitches. They're fun.
Yeah, so at the end of we had Tech Launch, we had professors, they come in and they are pitches. I had people from Harvard, people from UCSF, people etc. come in and actually sit in on the panel as each of them pitches. They pitch their company, so 5 different groups, let's say, 5-6 students each, or 10 up to 8 students would pitch their company, and they worked on that pitch throughout the semester, and so the top one in the first class, actually they did have a prize that, already getting money for the company was a big prize, but on top of that we were able to raise some money for that as well. So yes, thank you for being part of that. So there's so many concepts, and it is also, we have the business school comes in and works with them, the law school comes in and works with them. So I really, really very much embodies actually the BIO5 spirit, which is to have many different disciplines come in and work with them. So what I did want to say is, for all of the starting assistant professors, if any of them are out there, just remember, I think I think even Michael has sort of implemented with his program, don't be afraid to try totally new things as you start your own career. It doesn't necessarily don't focus just on the research, really kind of grow this sort of teaching aspect. That's the beauty of being here at the University of Arizona as opposed to other places. So.
Well, that was a good transition to another, really important, I think, program that, again, the environment at the University of Arizona and at BIO5 sort of took one of your brain never stopping ideas you walked in the door with, and again, you are all about mentorship. Everything you do, I think, is always through that lens of, how am I going to pay that forward, and what does it look like for those coming up, behind me. And so you popped in, I know, to our director's office one day and said, hey, I have a great idea. Yeah. My team loves it when I say those words. So tell us about, what that great idea turned into, and
So it's really interesting. I think probably for a while Dr. Barton saw me and she was just like, oh no, he's coming again. But this one, this was like actually they listened to my idea, and not only did they listen to the idea, they helped me implement it, which I thought was one of the biggest things about it, because a lot of times it's not enough to have an idea. You need to actually be able to back it up. And I was like, okay, we should do this. Well, how are we going to do it? I don't know. So when I was a postdoc at St. Jude, they had all these wonderful fellowships, and I said, wouldn't it be great if they had like maybe smaller individual fellowships that they could give to multiple students or multiple postdocs? And the reason being is when an institution invests in a person, it is far easier and far more likely for that person to go on and get individual funding for their particular career or laboratory. It's kind of like the Matthew effect. There's this tipping point that once you get past with funding, you start to kind of get the ball rolling and get more funding. So I said, I have an idea for a postdoctoral fellowship program. And I said, well, this is what we can do. We can give out, small awards to the postdocs. And the other thing with that is, as a graduate student, they have like a mentoring committee as they're going. It's their dissertation committee, and they give them advice. As a new PI, I actually also have a mentoring committee, and that gives me advice. But for postdocs, which are kind of like these trained mercenaries after they get their PhD, there's not a lot for it. There's not really a lot of mentorship. They have to, go out and find a mentor for A, a mentor for B, because Lord knows there's not only one mentor for anything. So I said, well, how can we incorporate mentorship in a fellowship program? And I said, well, we'll have the BIO5 fellowship program, and we can, give away money. But the problem with giving away money is you need money. And I didn't have any to give away. So
It's a good idea.
So I'm like, and that's kind of that, it's a great idea, but I can't really do the idea unless, somebody else is actually, paying them bills. So I got an email.
Why did you look at me?
Because apparently you funded this.
Yeah. I mean, you were in the meetings, you were in the initial emails, and you were like, behind the scenes, probably saying, I don't know about this guy. Oh no, you
never.
But I gotta, my mouth hit the floor when I got an email from Dr. Barton saying, how's 40 grand? I'm sorry, what now? Like, my brain broke. It was just, so what the program now is, and now it's, we actually just had our application cycle for our 4th cohort, is we give away 8 $5,000 awards to our postdocs. And we say, okay, give us the pitch on how this will help you in your career. It can be to do something for professional development. It can be something scientific, but give us what you got. And in addition to that, we want you to have a 3-member mentoring committee so that they can give you advice and moving forward with it. And we have them have an official meeting, have a summary of that meeting, have a summary of their project. In this, they actually learn how to manage their funds as an investigator, because when somebody handed me a grant as an assistant professor, I was just like, I know how to balance my books at home, but this is like completely different, and now I have to manage people as well. It was wild, but what this program did, what it does is it also helps them, know who to talk to in their department for ordering things or for managing their funds. And so when they go to that next level, they know that person exists. They know how to actually speak that language. They know how to manage their own funds, and hopefully the money that they get helps facilitate them getting the next award. And we've gotten, I'm really happy to say, we've had a lot of people in the program get grants from NIH, FDA, USDA, and it offers a tremendous actual return on the investment that BIO5 put into it for the institution at large. And it's great to see them go on to get jobs in pharma, jobs at institutions, it's just been a really fun thing to help manage. And I wouldn't have been able to do that without the BIO5. As far as you all kind of actually facilitating, helping managing those funds. We have people who help me actually help with the applications that come in through that website, and so for intake, for implementation, an idea is only as good as the people that work behind it, and the people that work here have been phenomenal.
Well, I'm glad I didn't do the thumbs down then. That would have been a bad story. That would have been a bad. Yeah, we are so proud of that program, and you have just led it phenomenally, and I think so many are benefiting, as you said, themselves and the institution and science in general. So thank you for your efforts on that. And Julie, I'm going to take it even back further. So, talking about educating that next generation, as you all know, and maybe some of our viewers know, we actually believe that we need to start getting students used to actual science, not into just in textbooks, but the actual application earlier than when they step foot in college. So we have our KEYS high school internship program, and we take students from across Arizona, come to the university over the summer and do a 7-week internship. And Julie, you've been a supporter from the beginning. You're actually on our board that helps us create ways for that program to grow. And you've had KEYS students in your lab almost every year. Do you want to talk a little bit about that and how important sort of that pipeline building effect is?
Yeah, it's a really great program. I have loved it ever since I came here in 2015. And I remember at the time the BIO5 director was Dr. Martinez, and he walked in my office and said, you know what, you weren't here when we were divvying out KEYS students, but I really think you should have one. And I said, oh, what is that? And he said, it's this great program. It's high school students. They come in, and they do work in the lab, and then they do a poster show at the end, presentation, and it's really great, and you'll love it. And I said, okay, sign me up. So it was phenomenal. I couldn't believe how much fun we had in the lab. The high school students have been really the cream of the crop from Arizona. And the bonus is they almost always come to the University of Arizona, and they almost always want to work in my lab. So it's been the best way to recruit the very best and brightest of these high school students that start in the lab, then they come to college, and then they have projects. So 2 of my KEYS students are actually on publications from my lab. So it's contributed to their career. They're off in medical school doing well, and it's just a really great. And I'm going to talk to you later behind the scenes about a fundraiser idea I have for kids. So it's gonna be, I'm gonna be even more involved, hopefully.
Be careful what you say out loud. It's now on live TV. So, that program is funded by philanthropy, and the BIO5 Institute leads it. But we couldn't have a program without scientific mentors from across campus, and we've been lucky enough to have I think close to 160 U of A scientists and staff be mentors to these students throughout the years, and that's an incredible wealth of riches for a high school student to walk into a Research One university and have lab experience before they ever even enter into their undergraduates. So again, thanks for all of you I know have supported that in one way or another. So we really appreciate that. Let's see. So we've covered some of the research, we've covered some of the education. Let's talk about innovation and how sort of, again, this collaborative, diverse, inclusive thinking, bringing people together. Not only can you do cool science, but you actually are moving the needle on some innovative projects. And Dr. Renquist, I know you and Dr. Khanna, chemist, biologist, and we talked about that. Compounds, related to reducing obesity-related diseases. I know you both have some startup companies that have resulted in the research that's going on. So talk to us a little bit about how you go from just being in the lab and saying cool to actually moving that needle forward.
So I think the key for me to understand was my postdoc mentor. He said to me, he's like, if any of your science ever gets out there and makes a difference in the world, it's a miracle. Because he was in the National Academy of Sciences, which is a huge honor in the scientific field, and the only thing that he had gotten out there in that was used by industry was a test, and he saved obesity, but that identified black and red cattle, which you can see that, right? So I'm not sure what value that was creating, but he was big on trying to make a difference. So when I first got here, I presented some research that I was doing. A fellow professor mentioned that he thought it might be applicable in aquaculture to improve growth in fish. I had worked on that with a focus on obesity, so I hadn't even thought about aquaculture, but he was insistent on us trying that. And I established that it worked in my lab. And I've established quite a few things work in my lab, but trying to sell those to industry and have those things make a difference is virtually impossible if you aren't willing to take it yourself. So I've started companies to at least get the ball rolling so that someone out there will take what we're doing in our lab and turn it into a solid, changeable, have an effect on the world. And we're improving growth in aquaculture. I sold that company actually to a large international company who I now work for as a consultant. So I've got a bit of a conflict of interest as far as saying that, but they're going to do great things with that technology. I'm just excited to see some of our science go out there and make a difference. So that's, yes, we're trying to innovate. Yes, we're trying to do good science, but we want that science to make a difference, and that's the biggest thing. And so what I'm really interested in now and what I'm working on both with my wife and with Mai is developing new drugs for diabetes, and we're really excited about where we're at with that. In fact, Mai mentioned that we had this undergrad who's now gone on to Stanford, and her undergrad who went on to Harvard, who identified compounds that could inhibit an enzyme that could be used to treat diabetes. And we've gotten to the point with those where we ordered the first 4 of those. We've tested 2 of them in mice, and they actually work. So we've got novel compounds that we're really excited about. And on the flip side, we've got a clinical trial going on at Washington University to establish that when we do develop these new compounds, they will work in humans. So science has to be translated to actually make a difference, and the only way it's going to happen is if the person who discovers it pushes it forward, I think.
It might have made a difference for the black and red cows.
Right,
You
yeah,
never
right.
know. Who's to judge, right?
The combination of that is really close to black, but not white.
That's right. It's all about perspective.
It was for the
right?
colorblind cows.
Yeah.
So what was I think really interesting too is when Ben kind of approached me and said, hey, we want these compounds for diabetes, but we don't want them to enter the brain. And I was like, wow, that's really interesting, because that's exactly the opposite of what we always think about, which is we always want our drugs to go into the brain because we're trying to go into neurodegeneration. And I think that's where, when he said it, I was like, that's a really neat idea. That's the exact opposite of what we want to do. But we always think about how to get it in, therefore we know how not to get it in, because most of the time it doesn't. So I think the innovation there was really, sort of like really, we meshed right away for that aspect, which was really neat. So.
Talk though about getting them into the brain. I mean, your work is so important in a couple of different areas, and I know, again, not just your research, but the companies that you are working on and have worked on and spun out in several different areas that impact many people. One is pain, epidemic of pain and how we deal with pain. And then Alzheimer's, and I know maybe people don't necessarily see a link there, but I think if you could just again maybe describe a little bit about how you can tackle both of those areas with your background.
Yeah, so as a chemist, we sort of I always think about a chemist, a structural biologist, about how molecules interact and how do we develop them into drugs. So for the pain aspect, that entirely actually goes, and it's a wonderful story because my husband is the one who really kind of drove that, discovered a really cool peptide that showed, I mean, he has a folder on his desk that's called the magic peptide. But unfortunately, right, drug companies don't want peptides because they don't get it in, they're very difficult. And so he and I, through talking about it, we sort of started talking about, what about a small molecule? And we started that. And Raj has taken Regulonics, which is a company that is in an amazing path. And he's really inspired me to sort of use that same ideas to drive our other companies. But that is and actually funny enough, tomorrow, I don't know if it's still embargoed, but a paper will come out that is just
Not
phenomenal.
anymore, it's not.
Well, I understand what the paper is.
Okay.
Tomorrow there's going to be some news, some really exciting news on his molecule and for regulonic. So really exciting things happening there because it's a non-opioid, non-addictive drug for pain. So huge impact he's having there. And all of that really inspired me to sort of start my own companies as we started to develop these small molecules for Alzheimer's and for ALS. And a lot of them, again, as I kind of mentioned in the beginning, are novel targets and how to target protein RNA, which were never druggable, protein, which were never druggable, and now even RNA. So really a very wide targeting minefield that's been sort of abandoned by many pharma. And I think that's where we're unique in academia, where I think pharma doesn't have it. First, we are fearless. We don't care, right? We have no investor telling us don't study this, don't work on this. We don't care. We get money from different granting agencies, but we are fearless, and we're not. Most of us are not interested in the money that comes out of it. That it happens to happen is wonderful, but that is not our drive. Our drive is finding a therapeutic, helping people, right? And so that's where I think is the most beautiful part of the innovation in an academic setting, that you can actually develop this without worrying about. I worked with a pharma company. They pulled out the funding for absolutely the most ridiculous reason that had nothing to do with the fact that this could actually work. That will never happen in my lab. We will drive that right to the max because we know that it has potential to be a therapeutic for these diseases. So again, if you are funding NIH, if you pay taxes, keep it up. That's wonderful. Thank you to all of you. Thank you to BIO5 and all of the ones that believe in us and let us do these really creative and innovative ideas. So with that, I've been able to set up companies like Launch. Forge has been really fantastic. If you're on there, Brian, I know you are, you'll be excited that, right, he's been involved with us in developing both the class as well as the company. And he's training. Jessa actually took the Forge program and loved it. So there is such a beautiful ecosystem now in Tucson that's really bringing out this innovation. For me, the biggest drive for the innovation towards these diseases was the Center for Innovation in Brain Science, which was funded by Health Sciences, and that was an amazing incubator for me. Dr. Robbie Brinton, who's the Center Director, really sort of gave me the reins to just go out and have the most creative ideas and go for it. And that's super exciting when you have a director, when you have a center that just lets you wildly do awesome ideas. It's really a great feeling, and I hope many more chairs and centers and directors and deans let their faculty truly drive the innovation and the research. It's very exciting.
Julie, we go from incredibly impactful things, pain, Alzheimer's, to asthma. I'll take us back to asthma because again that's important to me as well. And again, you're not just doing the work in the lab or educating, but you also, I know, have a new company that you have started with several of our BIO5 scientists and people around campus. Tell us a little bit about Raicido.
Sure, yeah. So when I came to Arizona, we had this idea, and it was just an idea at the time, and we met the right scientist, really could help us push this idea forward. We felt really good about, this potentially, we had a peptide as well, but peptides are not cool, so we got to make it a little bit cooler.
What is a peptide?
Peptide is just a sequence of amino acids strung together, so they can be degraded really easily. They don't last a long time in the bloodstream, so you have to make them more stable. So we had a medicinal chemist here at BIO5, Joseph Wagner, who's been helping us with our peptidomimetics, cooler name, and we licensed our product from the University of Arizona and formed a startup called Raicido, which purpose is to develop new asthma drugs. And our competitive space is really the biologics in asthma. So the cool thing about our drug is that we don't need a cell line to make it. Biologics need a cell line, so we can just have ours chemically manufactured. And it's based off of a sequence of a protein in your body, in your lungs, that naturally protect you from asthma. So some people with asthma, they don't have a lot of this protein, or this protein doesn't work. So we're trying to give them back a replacement that works better, but it's something based on the endogenous protein in your lungs. So you should have very little immune response to it, like negative response. So we're excited about that, and it's a thing that happened the last 2 years. We've gotten a little bit of government funding, so thank you for that, taxpayers. And we're trying to fundraise now with larger investment groups.
Will that be in an inhaler?
We hope so. That's our goal.
I hope so.
Yeah, but the end goal, like you said, is like you're never going to see this in a patient if you don't push it forward yourself, right? So like this was the thing, like we really think this could be a great drug for asthma patients because they don't have a lot of options that are new from the last 50 years. So like the mainstays are still there and they don't work for everyone. So we think our drug, based on the body's natural protective system, could really be a new kind of class of asthma therapy. So
Before I forget, there is tomorrow, we might need to send you this information for women, entrepreneurs, companies.
Okay.
There's a page that you can send this, so remind me to send this.
I'll definitely send it in
There we
there.
go. See, those sparks. That's what happens. That's very exciting as well. So I think I'm not sure where we are in terms of timing, but I want to make sure we get to some questions from our viewers, and thank you for those of you that have sent them in along the way, and we'll read through them and get to as many as we can. Let's see, and then we'll circle back at the end and give everyone a chance to do the final pitch. But so we have a question from the audience that what is the biggest challenge in nurturing diversity in academia as well as the field of medicine as a professional student? Dr. Johnson, would you like to try this one?
So I think one of the biggest issues is we have this system where we expect everyone to come to the table where we are, to be able to operate in the space that we are, to be able to look the part of where we are. And in doing that, that excludes so many people from so many different backgrounds that are unable to get to that point or don't even know that that point exists at that particular in that particular space. So I think one of the things that we really need to do more often is really meet students, whether it be middle school, high school, college students, community college students, people who just finished their bachelor's but still want some more, need more work to get to that particular next level for their master's degree. But what we need to do is figure out the best way to meet them where they are so that we can either bring them to the table by grabbing their hand instead of just expecting them to know where to sit down and how to operate when they get there.
Talk about meeting them where they are. Another of your sideline little projects.
Very small.
Yeah, talk to us about NSERP. I think in a lot of ways it addresses what you're describing and sort of again that pipeline building effect and meeting people where they are. Can you just talk a little bit about that program and
Absolutely.
your investment in that? And
Yeah. So when COVID hit, a lot of people lost their opportunity to do summer research. So summer research is something that students do. You have your key students do them so that they know how to find those opportunities in college. But once they get in, but those who don't have the keys program, they get to college and they need opportunities like that so that they can get to the next level for a master's program, a PhD program. All of these scientific endeavors help them get to that next level. So many institutions have summer research projects, but again, those were canceled due to COVID. And the people who are disproportionately affected by those are people who are from underrepresented backgrounds in STEM fields. So I said, so we had COVID going on, and we had basically other racial tension pandemics going on, and I needed something to get rid of that negative energy because there was a lot of it.
Yes.
So much. So I said, well, what if we came up with some kind of program where we matched undergraduates to professors to have them do a virtual research program? So we called it the National Summer Undergraduate Research Project. So it was basically virtual projects for undergraduates from underrepresented minorities, and we literally put it together in like 11 days, and then we had the call open for 5 days, and we said, well, if we match 20 people, we're doing great. in that 5 days, we had 250 people apply and over 100 mentors. And I was literally matching them on my 15th anniversary so that on that following Monday, we could actually have them start in the laboratory.
Your wife is a saint? Is that
Yeah,
what you're saying?
so that goes into, just how much sometimes we have ideas, and those ideas mean nothing unless we have the people behind us that can support us to have those ideas go forward. If I didn't have her support, if she didn't see the vision that I had for that, then it wouldn't have happened, right? And if people didn't see the vision for the Keys program, if you didn't see the vision for the postdoc program, if you didn't see the vision for your class, they wouldn't happen. It's the people behind that you to kind of help you do that. So when all is said and done, last summer we matched 250 students to mentors, so students all over the country, mentors all over the world. And then this year we actually got some funding, not only from the University of Arizona, but also the National Science Foundation. So again, your taxes, awesome. Thank you very much.
Right.
Theme of the night. Thank you. Viewers like you. But so we had this year we had fully funded. So we actually paid the students full time for their research. So there were 66 people in the program. We expanded from microbiology to now microbiology immunology. If they needed a computer because their house computer didn't work, we were able to do that. But the thing that we really learned from this particular program was that when COVID ends, and hopefully it'll end, these students still wouldn't have been able to make it to those particular programs. They still wouldn't have had that opportunity because they had things at home that prevented them. They had family, caring for elderly parent, or caring for their sisters, siblings, caring for their children, health-related issues for themselves that prevented them from going, money because they couldn't travel. They needed to be able to keep that money at home. So they wanted to be at the table, but they just needed the hand to bring them there. They needed to be met where they were.
Right?
That's great.
Exactly. So this is a great question, and Julie is fundraising now for us. So this will do you think you could take something like the Keys program and support it in the community college level?
Wait, before you answer on fundraising, that is John Garcia, the program director of ABRC. If you want fundraising, you should.
There we go.
Thank you for being here, John.
Yes. So, should I? In my spare time, my team runs the Keys program. So it's very passionate about Keys, as are all of us at this table. But we get asked to expand Keys all the time, and we have any conversation that we can have about doing so. We have kept it at the University of Arizona due to a lot of logistic challenges and funding challenges that we can talk about another time because we want to stay positive. But it has benefited us to stay here and to grow the program here, but always happy to have conversations. Our contact information will be in the description of this program event, and I'm happy to have anybody reach out to me and have conversations. I mean, it's an incredible program, and yes, I mean, if we removed all boundaries, which I think is sort of the theme of this evening, we would love to have Keys be, in other universities and other states, community colleges, because it works. The pipeline building effect is huge, and it works, and we have the model. We have honed over 15 years now, and please reach out to me.
I think also this aspect of sort of having college students mentor high school students should be more. It's almost like you should have every high school student should have a college mentor and connect them, right? So ABRC, BIO5, and serve listener,
because we do take community college students.
There you go.
But if you had every high school student could reach out to a college student and be sort of a brother, sister, right? An elder that could sort of help them. Because often I think, and I see their heads nodding, so I know that they've gone through this. When
Yes,
they first
we have a lot
come
of
in
good
their
students.
first semester, it's so intimidating. You don't know, despite having heard how intimidating it is, despite knowing how hard it is, they still get intimidated on their first semester, and it's still, so if you pair up every one of them with someone, that's an opportunity, especially local talent. So many high school students here need that, and need someone that they could turn to. I think that would be a really wonderful opportunity.
Yeah, absolutely.
But I think Michael's program takes advantage of one other thing that happened was we all became used to virtual meetings. You know, science has turned highly, you know, there's a lot of online tools that we use throughout science. So a lot of science now can actually be done from your home office or from your home. And so, you know, getting students involved in science projects that can actually be done at home that are real science, that have a chance for failure, is, you know, an unbelievable thing that couldn't have happened 5 years ago even. So
Yeah, absolutely. And we are now doing that. We are building out keys. We had to pivot to do that, exactly what you're describing, as everybody did. And now this upcoming year, we're going to attempt to do a dual track. So because you're right, the value is there. Again, scientists trained in the bench, are like, oh, I have to use data too. So they're getting both. So yeah, I mean, there's endless possibilities.
And it's an area where the young college kid or the high school kid might be better than the professor at doing this. Right. And so this might be an opportunity for them to teach us.
Yes.
Which we just talked about.
Train the trainer.
Yeah, the trainer. So I just wanted to echo how I love the idea of the college student mentoring the high school student. So a lot of people don't know this about me, was a first generation college student. So even filling out applications was overwhelming, and thinking about going to college was overwhelming because I didn't really have a lot of people to talk to about it. So having a mentor like in place would be really great. Yes.
More food for thought.
See, John this year, we'll talk about keys.
we will. Get in touch with you. So let's see. John is, thank you. Happy that ABRC was able to play a synergistic role. So thank you again for that. And Dr. Khanna and Dr. Renquist for your contributions regarding that.
The Arizona taxpayers.
Yeah. So, I think I want to just kind of open this up, and you guys have all touched on this a lot, I think, in different ways throughout sort of this conversation, but from where we are in this moment at this table to look into the future, both for your own work, for your students today, for our students of the future. How can we continue to work together, sort of again, removing the boundaries at a university, which there are boundaries at universities and in companies and other places, but trying to remove those, supporting diversity, and again, by diversity we mean diversity of everything, right? Like diversity in every way you can think of it, and just sort of ignite science. I mean, use that leverage to reducing the boundaries to ignite science, throughout the university, throughout the country. Just what are some of your ideas as you sort of think about that in your own worlds?
So I recently had spoken to high school students at Yuma, and one of the things that I told them, and I kind of want to say this to the audience and to all the students, be fearless. I think that's so important. I think that's what when we first came, I'm not from the U.S., right? I was born in Africa, and we came for opportunities in the U.S. What is really unique about the U.S. is the diversity. It was sort of going, right? I lived in a country where, interestingly, I was a minority there. I was, right, a minority white person in a predominantly African country. And so I sort of lived that aspect of being a minority. And coming in the U.S. is just seeing diversity, especially in a university setting, was so awesome to me, was so exciting. And it was that my uncle, who called us, who was here, called us and said, we had a couple of choices to go to other countries. I was a French speaker, so we had French countries we could kind of consider. But he had said, forget it, the U.S. is where you want to be, because there are so many opportunities. And the opportunities came from fearlessness. So if I can say anything to anyone that wants to go into science, be fearless. enjoy. Science is one of those places where you can imagine anything and it happens. So that you can take a blood and turn it into stem cells that can then be turned into any cells in your body. When I first discovered this, was like the coolest thing ever. And it was like, what? So if you can imagine that you can do, one of you can do this in the future in our body, you can convert any of our cells to the cells that we need. That's the future of true medicine, and that's the calling to all of you out there. Get excited about science. It's a wonderful time to be in science. So.
Yeah, I think creating excitement around it is key. We have excitement about football games, excitement about basketball, excitement about stuff like that. We should be equally excited about science and education and music and all of the things that happen at a university. And so, when you're thinking about what field you want to be in, try and figure out what makes you excited, go forward with that. But it's also our job as professors to make our students excited and to encourage every single one of them and to create that atmosphere. And I think the best place to start is in high school, because when they come into college, they've selected a major, they've decided they're going to be a science major or another major. And so I'd like to get them earlier.
So music.
Music, yeah.
How did you get here?
Yeah, so
Back to the music.
I was pre-vet, and then I worked in a vet hospital, and I was no longer pre-vet. Just realized it wasn't for me. And I was, I had, all these music classes. So I was literally a music major. So I don't know how many professors in STEM didn't have a STEM major, like at all, but no one. And I say that because, there's so many different paths you can take along the way. And if you are rigid, if you're just saying this is the only way I can do it, then frankly, you are incorrect. I think that sometimes it might take more work, it might take more determination, it might take the need to be fearless. But I think that when you find your passion, you can at least try and go after it, and hopefully your passion is something you can also monetize. But I also wanted to go back to this kind of, this doing science, moving science forward, and kind of like the innovation piece, and how that kind of incorporates into our jobs here. And one of the biggest things that I think we have as professors that helps us move science forward is autonomy. If you're, if you are scared to swing the bat, then you're going to strike out. I mean, you're just that actually happened to me in Little League. My first 2 seasons in Little League baseball, I didn't get a single hit. I was really tiny. I just crouched, and we were in the playoffs, and I'll never forget it. Like a person was on base, we were down, and I was just trying to get on base. I was just trying to walk. I didn't want to swing, and the umpire had this really annoying sing-songy voice, so when he called strike 3 on a ball that was clearly outside, it was strike 3. I'm like, oh, you're just rub it in. But as I walked away, and I'll never forget that, he said to me, you gotta swing the bat, son. You gotta swing the bat. And that just stuck with me, to this point where, as a scientist, if you want to get something done, you gotta swing the bat, and you gotta, have that autonomy to swing the bat. So we don't know what additional virus, what other disease is going to be around the corner. We know the ones that are present right now. We're doing everything we can to fight them off. But we don't know what's around the corner. So we need to be able to have the autonomy to study things that have not been studied before, and be free from criticism to study those things, because you never know when in 2002 somebody was looking up a drug and said, oh great, that's the new Pfizer drug that's right now to help against COVID. The first paper for that was in 2002. They didn't know what they had, but now it's a great thing. So what if somebody said, well, that's stupid, we shouldn't be studying that right now? So it's that autonomy that gives us the ability to do the science that we do, and we would literally be nowhere without it as professors.
Good point.
Any thoughts, Julie, to follow that?
Oh man, I don't know if I can follow that up. I have little bits of wisdom like be willing to ask, questions. Be willing to ask questions to your, leaders. Like be willing to reach out and say, I need mentorship. If you need mentorship, even me. I mean, I meet with people all the time, and I'm like, okay, I need help with this idea. Like I can't do this by myself, and I think it takes a lot of courage to reach out sometimes because we try to want to do things ourselves and be independent, but sometimes we have to reach out for help and be willing to accept advice. And, so that's my pearls of wisdom. It's not a great story like Michael's, but.
But I think that, everything you all just said wrapped up in, this package of, but I would say also, and maybe this is more from sort of an outsider standpoint because I'm not a scientist, but again, and maybe this isn't as unique of an environment as I think it is, but be fearless, have autonomy, ask questions, reach out, but here there's a net under you, there's a team, there's people, there's your colleagues, there's people that work at the university that are Michael walking into a door and saying have a great idea, and we're not scientists, but we are here to be able to support ideas. So I think that what I have found just so incredibly gratifying and inspiring at the U of A, at BIO5 in particular, is just seeing that you all do have this ability to be brave, fearless, ask questions, have creative ideas, fail, but you have people around you and underneath you, and so do we, by the way, and that's just a really, really cool thing. I want to say that as well, because I think students, come into an environment like this, and it's complicated. I presented to a physiology class last week about, and they were doing a professionals panel because of the same thing. Like they're studying science in the classroom, they don't really know, they didn't know what to do after that, and so again, you have all these resources at a university if you're a student, if you're a professional, if you're a scientist, and but yes, you have to be fearless and put yourself out there and ask for help. So,
but if that's the hurdle, then we understand the hurdle is you have to be fearless. And what we need to do to increase diversity, which I think was the initial part of the question, is try and shrink that hurdle, right?
Yes.
And so that needs to be something that we try and do as much as we can, at least at the university level, to help people, a more diverse population succeed.
Know your opinion is valuable and listen to. It really is. All of your stories tonight, lend themselves to that concept. Is many of the things that are being accomplished wouldn't if you didn't stop and listen to the people around you and hear their point of view, even if you did not. Even if it was going into the brain or out of the brain. Right. So. I think with that, I don't see any more new questions. So any last thoughts, or we've shared all the wisdom we can share tonight?
Any questions from the audience that we actually have here live?
Yeah,
want to ask us some questions?
Put them on the spot.
Yeah, exactly.
Yes, Faye.
How long do you think until you might get into human trials for your asthma?
Oh my goodness. I would like to think soon, but that's not the reality of the situation. We believe our next steps, we anticipate our next steps. We need to do the large animal studies, which we have decided will probably be rats and canines, like the two that we have to test in. That'll probably take 2 to 3 years, and then after that, we would be, if everything was successful, we can put in our application to do clinical trials.
I volunteer.
Oh my goodness, that's amazing.
Oh my goodness.
Wow.
The question for the viewers is when are we going into clinical trials for that new asthma?
And we should have a volunteer.
We have a
Those
volunteer.
volunteer in the audience.
Yeah.
And I think that speaks to science. Like, you have to be persistent.
Yeah.
Because it's going to take.
Yeah.
You've been working on this for now 10
About
years?
10 years, yeah.
It's going to take that long.
Yeah.
And I think people do need to understand that about science as well. It is not always quick or easy. So.
You guys have mentioned a lot today the push for the diversity in STEM, and that one of the ways of doing that is reducing the barriers to entry. What are some obstacles that you had to overcome to get to the positions that you were at, and what tips can you give a student who's facing a similar situation?
So the question for our viewers was, what has your experience been, to our panelists, in reducing obstacles, barriers to diversity and getting to the place where you are today?
I have a good answer for this because this was actually real life, happened to me. I grew up in Georgia. I have an accent for sure, but
A beautiful accent.
when I was in my undergrad, getting my bachelor's degree in genetics, it came to my attention. I was in a lab, and the professor was like, "You are not very good at writing.
Oh, no.
Like you need." He said, "If you want to be a successful scientist, you need to read like all these classic books." And he was so sweet. He brought me this huge collection of classics, like all like great literature that we'd have to read, And he said, "I want you to read them all and then like write me a 1-page like report." And I was like, "I'm in a science lab." He goes, "This is what you need. Like if you want to be a faculty member one day, you got to do this." And so I attribute me being able to write good grants and good papers to this professor taking the time to care and saying, "You have a deficiency in this area. You're a great scientist, but your writing communication is like not that great." And he really helped me that one semester that I had to read books. He really helped me like tune into like my writing skills. And if he hadn't done that for me, I would have definitely not be here today for sure.
That's incredible.
Yeah, so that was my hurdle to get
Sometimes
over.
it only takes one person, and sometimes it's hearing the things we probably don't want to hear, but we need to hear, right?
I
Yeah.
think one big thing is you don't know what you can achieve if you don't see somebody in that position that you can relate to. So in that particular regard, representation matters, and it matters significantly. I had a student come up to me literally yesterday and say, I'm now in medical school, and throughout my elementary school, throughout middle school, throughout high school, throughout undergrad, and throughout what's been going on, you're my first black teacher.
Wow.
And let me tell you that one, that was an honor well, hopefully I wasn't horrible. And she said, "No, you were actually pretty decent." So thank you. But the weight of that situation, not only for the student, but also on the teacher itself, to kind of have that responsibility to be that only person, that person that was in that role for her. It's that in itself is not only a barrier for the student, but also I think sometimes progress for other things. So, I'm really happy that, the University of Arizona is actually trying to put forth, grants to the NIH to kind of, there's like these things called a FIRST grant to kind of add more, basically really trying to add more funding to really give it the call to get more a more diverse faculty set. I'm working with my society to try and have more increased diversity at the postdoc level to help support them to get fellowships and awards, and of course at the undergraduate level to get them. So it's basically the high schooler sees the college student, the college student sees the grad student sees the postdoc sees the PI, and I think it's in this entire process, having a more representative set of people at each stage is something that I think truly will decrease those barriers.
That's great.
Yeah, representation, seeing women who are CEOs, right? And so I'm CEO of a couple companies, and I think more seeing that is sort of understanding that you also can do it. We definitely have much fewer women CEO that we should have, and I think exactly as Michael was saying, I think the more we see this, the more exciting it is for us to believe that right, it's something that we can achieve, and there's no hurdle. I think that's fantastic that we are starting to see this more and more.
This is probably something that, as the lone white male on the panel, I feel a little awkward speaking to. I will say the hurdle that I had is I didn't know what opportunities were out there. And so, but I think that applies equally to everybody. We need to tell people about what type of opportunities there are, like Keys or NSERP or any of those. People can't apply to things that they don't know about.
We have to pay attention, though, I think, that just like you were saying, in diversity, right? So I had a student who comes from a very poor background, was a white male, and I had written to UCLA saying, listen, this is the first generation, this was a young man that didn't have any opportunities, and I think you should consider it. And I did receive back this idea that, no, sorry, we don't consider that. And I think that's wrong, because there is also diversity of where they came from, their background, which is equally as important as anything else, right? And so I think we need to consider every case in terms of how do we increase it. But certainly for Michael and I, and for women, for minorities, obviously, it is fantastic that we are a representation for people who haven't seen us at these positions as much, and I think it's amazing. But we do have to keep. So you are also important in our in this movement.
Well, wow. I mean, I don't know. I hope all of our viewers got as much out of tonight as I did. Thank you, Dr. Renquist, Dr. Khanna, Dr. Johnson, Dr. Ledford, for your time tonight, for all you do, for the world with your science, for our students, and their path to their future, and just for being really inspiring role models in your own right. And thanks to all of you for joining us tonight. I hope you enjoyed it and you learned some useful things. This is going to be an ongoing event series. We're really excited to be continuing this BIO5 Ignite Science conversation. So if you'd like, please consider going to our website or the link in the description to get on our newsletter so you are in line for some upcoming dates. We also really want to provide content for our viewers that's useful and valuable to you. And so we did provide a link to a survey if you have a few minutes of time to go in and fill that out so we can make sure we bring you information and content that is useful and inspiring to you as well. With that, thank you very much, and we appreciate your time tonight. Good night, and thank you from all of us at the BIO5 Institute.